Welcome, interns, to the clinic floor. I am absolutely thrilled to have you all here today. Consider this explainer your essential clinical briefing. I'm going to be your clinical lead as we master the safe, effective administration of iontophoresis. This isn't just about passing your next exam. It's about mastering a highly effective modality while prioritizing the absolute safety of the patients who trust us. We're going to take that biophysics you learned in the classroom and translate it directly into hands-on clinical skills. Let's get to it.
Okay, let's take a quick look at our clinical syllabus. We're covering 6 critical areas today. 1. The polarity rule. 2. Calculating safe dosages. 3. Selecting the right ion. 4. Patient and skin preparation. 5. Safe electrode placement. And finally, 6. The treatment procedure. All right, Section 1, the polarity rule. Let's establish that biophysics foundation.
So the entire mechanism hinges on a really simple law of physics. Like charges repel and opposite charges attract. With iontophoresis, we're using a continuous, low-voltage, direct current to electrostatically repel a drug right through the skin. It's kind of like pushing 2 negative magnets together. They push apart, right? That's how the medication is physically driven through the stratum corneum, via pores, hair follicles, and sweat glands, straight into the localized tissue. But to make this work, the active electrode's polarity literally must match the net electrical charge of your medicinal ion. If your drug is positive, your delivery electrode has to be positive. It's really that simple and honestly that strict.
Moving on to Section 2, calculating safe dosages. This is all about balancing intensity and time. Okay, I need you to commit this formula to memory. Look at those keywords on the screen. Therapeutic dosage is always quantified as the product of current intensity, which we measure in milliamps, multiplied by time duration, measured in minutes. You really can't just look at intensity alone. It's the combination of how much current you're pushing and how long you're pushing it that determines the total medication delivered into the tissue.
Now, the standard target dosage we generally use as our clinical baseline is 40 milliampere minutes. This is basically the sweet spot for getting an effective amount of medication in there while keeping the treatment time pretty reasonable for a standard outpatient visit.
But here is where your clinical judgment really kicks in. A standard treatment might be, say, 4.0 milliamps delivered over 10 minutes, which hits our 40 milliamp minute dose perfectly. But what if your patient has incredibly fair, sensitive skin? Or what if they start feeling discomfort? Well, you adjust. You lower the intensity down to 2.0 milliamps and extend the treatment time out to 40 minutes. You still hit that 40 milliamp minute target. Remember, our absolute primary directive is patient safety, and lowering that intensity is your first line of defense for protecting delicate skin.
Section 3. Selecting the right ion. Let's talk about matching pharmacology.
Understanding polarity matters immensely when we're dealing with these drugs. For example, if a patient comes in with localized inflammation, like a really nasty case of plantar fasciitis, we frequently use dexamethasone phosphate. Notice its polarity is negative. Because of that, you must place it under the negative cathode to drive it into those inflamed tissues. On the flip side, lidocaine for acute pain relief is a positive ion, so it goes under the positive anode. If you mismatch these, you're literally just holding a wet sponge against your patient's skin. No medication is getting delivered.
All right, Section 4, patient and skin preparation. Let's go over our crucial safety pre-checks. Listen up, team, because this step-by-step prep protocol is totally non-negotiable. Step 1, you screen. Verify their skin sensation is completely intact and check for contraindications like pacemakers or specific drug allergies. Step 2, you absolutely must cleanse the skin site using alcohol or a mild soap. Why? Because we have to strip away the natural lipids and sebum from the epidermis. Doing that significantly lowers the skin's electrical impedance, which is key to preventing heat burns. And finally, Step 3, saturate your electrode uniformly. We do not want any dry, high-resistance burn spots.
Moving to Section 5, safe electrode placement. This is all about preventing burns.
Okay, I'm dropping my tone here to warn you. The negative electrode, the cathode, is highly dangerous if you mismanage it. As that direct current flows, excessive current density at the cathode creates sodium hydroxide. In plain English, it creates lye right there on the patient's skin. This strong alkaline reaction causes something called sclerolysis, which is a severe softening and destruction of the tissue. And let me tell you, that takes a very, very long time to heal.
So how do we combat that caustic chemical reaction? We rely on a strict size differential. When applying double iontophoresis, you must make the negative electrode at least twice the size of the positive electrode. It doesn't even matter if the negative pad is the active delivery pad or just the dispersive reference pad. By doubling its physical size, you spread out that electrical energy, massively reducing the current density per square centimeter and effectively stopping those alkaline burns before they start.
Positioning is another critical safety mechanism. If you're treating a joint like the knee, do it in a sitting position with some popliteal support under the leg. Patients should never lie down with their full body weight pressing onto an electrode. Doing so creates an ischemic condition. You're physically squeezing the blood supply right out of the target area. That flowing blood naturally acts as a circulatory cooling sweep, constantly carrying heat away from the skin. If you block that blood flow with heavy body weight, you trap the heat and you are guaranteed to cause a thermal burn.
Also, if you're ever fabricating custom electrodes from towels and aluminum foil, which by the way is a fantastic, cost-effective clinical skill to have, you have to prepare them perfectly. You must press out all the excess water and completely eliminate any unwanted wrinkles. A wrinkle in the towel means the electrode is not sitting flush against the skin. That tiny air gap creates high electrical resistance, and where there's high resistance, there's rapid heat buildup. So keep it perfectly smooth and keep it flush.
Section 6. The treatment procedure. Time for our execution protocol. When you're out on the floor, follow this strict protocol. Most importantly, take special care to turn the generator on and off incredibly slowly. Direct current is powerful stuff. If you ramp it up or down too quickly, you'll trigger what's called the make/break phenomenon. That causes a sudden, startling, and honestly very uncomfortable muscle contraction for the patient. Always monitor the milliammeter, ensure the patient feels only a slight tingle, absolutely no burning, and always thoroughly inspect the skin under both electrodes the second that timer goes off.
All right, I'm going to leave you interns with a clinical scenario to test your reasoning. If a patient reports a painful burning sensation just 5 minutes into a 4.0 milliamp treatment, what is your immediate clinical action to protect their skin while still trying to ultimately complete that 40 milliamp minute dose? Review your math, prioritize your patient's skin integrity, think back to what we just discussed regarding intensity and duration, and I'll see you out on the clinic floor with your answers.